Okay, so for this project, I want to give you a short summary of our RM project. So this is a big team. We try to understand the heat house impact in subtropical high density cities. And according to the key message from AR6 IPCC report, the latest one, the uh, chapter 6 from the grouping 2, they talk about for this kind of implementation, climate change adaptation at sea levels, we need more scientific based evidence assessment, and the data should be downscaled to the city level. And we also need to understand what is the potential risk under the future climate change different scenarios, and incorporating and implementing the adaptation into the local policy and also the urban development. The climate change, this kind of adaptation data information sharing is also critical. And more important, apart from understand the scientific analysis of the climate change adaptation, we also need to understand what is the potential multi-benefits related to the social, economic, or even the human health. So that is why we start this project. If you read the latest IUC newsletter, this is a short summary of this project. So we try to follow the IPCC ER6 report's key message. And we start this project about 3 years ago. And so you can see the framework of this project, including the three parts. The first part is talk about climate data, how we downscale the climate change modeling to the district level. And second part is we focus on the built environment, and we link the outdoor and indoor together and propose the mitigation design guidelines to change the building sectors. And later part is because we talk about how to increasing the resilience of elderly people. So that is why we work together with people from psychology, from the Institute of Care, and also we work with NGO like the Red Cross and Senior Citizen Union, try to provide the service and support based on our findings. So you can see this is like a down to the ground levels implementation project. Um, yeah. So this is a recent news. Nowadays, we are not only facing the global warming. Actually, we are officially into the era of global boiling has just arrived. And if you refer to the data here, you can see this is this year's data. The last month, July, is the hottest month on record on Earth. And apart from that, as least in Asia and also European cities, countries, we are facing the era of the aging society. In Hong Kong, by 2040, one-third population will be the aged people, and with the age above the 65. And also when we talk about Hong Kong, this is a high-density city. If you watch the movie Transformer, this is a place they take a shot. And in Hong Kong, when we talk about high density, on one hand side is a high population density, the other one is a high building density. So if we say the regional level, we know that the past 8 years was the eight warmest on record. And at the national level, China and precedent heat waves were past the 70 days mark last year. And for Hong Kong, just last year, the July 2022, this kind of seasonal heat broke 11 records in Hong Kong. And so according to the projection done by Hong Kong Observatory, we know that in future we are facing this kind of uh, accelerating increase in urban temperature. In good old days, we still have cold, cold days, but according to the projection in the future, you can see the cold days decrease dramatically, while the hot night and also very hot days numbers increasing. And by the end of this century, the estimation projection shows that around 120 days and 160 nights will be extremely hot weather situation. So that is literally every night, every day in the summer, it will be the extreme hot. And according to the local public health researchers, we know that this is situation when we talk about extreme heat, the people's health condition, the smoke stress situation will getting worse and worse, and eventually they could die. So that is why when we talk about climate change, especially the heat resilience, we have to work with people from the public health, from the Institute of Aging, and try to have this kind of multidisciplinary collaboration project. So before we start the project, actually, as a researcher, we quickly run this kind of literature review, try to understand what has been done in this field. And according to this, we found out there's four important message. The first one is for the heat wave, there is a lot of global studies, but more important, how we act locally. And many reports, global reports, that talk about UHI during the heat wave could even bring the even worse this kind of health impact, and how we evaluate this at Hong Kong, and what is the spatial temporal pattern, how about the daytime and nighttime hotspot situations, what's their spatial pattern variations, etc. in terms of intra-variation. And also we need to evaluate heat-related health impact so we can provide this kind of responding heat action plan. And many papers talk about land surface temperature, but can we adopt the air temperature to evaluate the hotspot and hot spell? Because people feel the air temperature instead of surface temperature. And also how we do this kind of heat risk implementation, considering combine the heat hazard, exposure, and vulnerability. So that is our key project. The first challenge is a question raised by Hong Kong Observatory. Because there's no universal definition about extreme heat or the heat wave. So that is why we need to define our local hot spell and also heat wave definition. The first one, we work together with public health researchers. So we try to understand, evaluate the impact of different types, lengths, occurrence, timing of extreme hot weather, all-cause mortality. For the Hong Kong Observatory, they want to update their warning system. On one hand side, that linked to their weather forecasting modeling, but also they need to understand what is the corresponding health impact. So that is why we have to understand, identify the different interactive of extreme hot weather conditions between the daytime and nighttime, and also determine what is the vulnerable populations during this kind of extreme hot weather event, and also suggest a typical heat wave definition for Hong Kong, estimate its lag effect on all-cause mortality. So we adopt the different indicators. In Hong Kong, we have two extreme hot weather indicators. One is when the daily maximum temperature above and equals to 33 degrees Celsius, we call it very hot day. And for hot night, it's minimum temperature above the 28 degrees Celsius. And then we check the different lengths, occurrence, timings, etc. to identify the different types of this kind of extreme hot weather warning situations. And according to the result, we find that actually in Hong Kong, this kind of hot night will bring higher health risk than the hot days. That makes sense because Hong Kong is a high-density city, and we have this kind of intensified urban heat island during the night. And so if we have a consecutive hot night, this kind of associated with higher mortality risk. And also we found that female and elderly citizens are more affected by hot weather during the nighttime. So we provide this information and also the summaries to our Hong Kong Observatory. And then we have a second question. Is there any spatial variation between very hot days and hot nights in Hong Kong? And so that is why we try to map out this kind of spatial patterns of extreme hot weather conditions in Hong Kong and to determine the factors of built environment potentially contributing to the spatial variability of extreme hot weather. For this one, we adopt hourly air temperature data from 40 Hong Kong observatory stations, and also adopt the land use regression model to map out this kind of map. So surprisingly, we found the spatial pattern of very hot day and hot night are very different. During the daytime, we can see the rural areas, they dominate this kind of hotspot area. And well, for the nighttime situation, the most downtown areas, they can be observed as a hotspot in terms of the hot hours. And so that is why later we provide this kind of heat hazard map with local policymakers and also planners. We can point out, so there's a hotspot and also provide the improvements from the design perspective, such as ventilation, greenery, etc. And then we also have another paper based on that previous paper. So this one is talk about extreme heat risk assessment. So now we have a heat hazard. How about the exposure and also the vulnerability? So we collect the census data from Hong Kong Census Survey Department to understand the social demographic situation and also the population data to map out the real heat exposure and vulnerability. For this study, we can find that there is spatially variant and also high-risk spots was determined at the community scale. And people can refer to the heat risk to say where is hotspot situations, and also they can trace back the reasons, whether this is all because of hazard or because of exposure or vulnerability. So the local policymakers, they can have a very detailed data and information to make their decision. And then we came to the present street because if you read the global discount report, they always tell you the urban heat island will bring the exaggerate this kind of health effect during the heat wave. But what happens in the real time? So that is why we adopt the climate data from Hong Kong Observatory to map out this kind of urban heat island, cool island effect. The mapping showing the during the extreme heat what happened in Hong Kong. And we found that surprisingly, not only the UHI effect intensified, even the urban cool island effect intensified too. So that is why one of our recommendation to the local people is they can try to have early morning exercise instead of doing the exercise in the evening. Apart from my presentation, we have a big team come to this conference. If you're interested in the machine learning part, I would suggest you of this morning session. And then later, after my presentation, Dr. Janice Ho will tell you more about the mortality patterns and the extreme heat and also now extreme urban heat island scenarios, i.e. how urban heat island will bring in this kind of mortality risk. And also Dr. He will show you the ventilation situation. We're using the city scale LiDAR measurement to talk about extreme heat situation. And also my students, she has done the measurement. So we'll tell you how building and greenery characteristics will influence the thermal comfort in the residential public housing in the evidence in Hong Kong. For the real implementation and applications, because we work with Hong Kong Observatory, so we can see based on findings, the Hong Kong Observatory enhanced the precaution back to the 2021. And then later, last year, they have a new indicator, i.e. they talk about prolonged heat. And this year, they also released a new indicator talk about extreme case, i.e. when the temperature reached the 35 degrees in Hong Kong at headquarters, they will issue this kind of warning. And also, the previous one I show you the risk map, but now we work with local community and also government because we found that this kind of map can identify where the community level adaptation should be prioritized. For example, we identify the high level this kind of risk areas, but once we saw the community hub which opened during the extreme hot weather situation, it seems there is very limited resources from the government to support this kind of community resilience. So we show this and also try to improve this situation with NGOs and also the government. And apart from that, the task B talk about built environment. We work with construction industry and to make a design manuals and tell them what is the better design strategies, how to improve their design. And also we work with Hong Kong Red Cross because they focus on the risk management, especially community resilience under the changing climate and also health. So later we'll develop this kind of protocol and also action plan for the NGOs, especially for Red Cross. And for the publications, if you're interested, if you want to know the whole story of our project, I strongly recommend you read this book chapter. And actually, the whole book is also good. And for more papers, you can find from the ResearchGate. And also, we would like to acknowledge the funding from RGC for this project. Yeah, that's all. Thank you. Okay. Any more questions? Yeah, please.
For like your response to your and I was wondering for the very hot night, the map, the areas of high vulnerability, like are they directly corresponding to residential areas?
Actually, for me, how to say that we cannot see the detail this kind of situation, but the public, how to say, the health data is collected from entire Hong Kong. So to some extent, even I guess we turn on air conditioning, but they still have this kind of health outcome, negative health outcome. But for that part, actually, we have a collaboration with Hong Kong Red Cross. So in the next 5 years, we want to have more this kind of close collaboration to understand the indoor situation and also how the elderly people, the poor people, we can provide more better service and support to them. Yeah. Thank you. Yes.
Thank you for the informative talk. I'm curious about the findings about the question 3. Is there a meaning of the decrease of the tunnel heat island associated with the tunnel radiative cooling or any other factors for the result?
I'm not sure I'm following your question.
So it's like you said nocturnal cooling and nocturnal nighttime heat island was decreased in the very heat wave situation.
Yes.
Is that from the radiative cooling more than the ordinary day?
Because we adopt this kind of local weather records, so we cannot differentiate whether this is from related this kind of data or the other reasons. But if we're running the simulation part, I guess we can give you a more detailed reasons on detailed findings.
How do you think about the physical meaning of this?
For us, because we first this is the first step, so we can map out the urban heat island situation and also understand the intensity, etc. And the second one is we want to see what is the corresponding health outcomes. So that is why later Dr. Janice Tong will present that paper after my presentation. But we haven't done that this kind of how to say the parametric studies to understand each factor's contribution to this kind of intensified urban heat island. But I think that is a good question. Maybe later we'll do
In
more.
heat wave situation, the atmospheric stability is stable, then nighttime radiative cooling become more activated. So I think that could contribute to the reduction of the temperature in our area in heat wave conditions.
Yeah.
Is that possible?
Actually, we have an ongoing project using the LiDAR to do this kind of, we have a network LiDAR measurements in Hong Kong. So first we want to understand the vertical profile during the different situations, and heat wave definitely is one of interest. And after that, we can see what happened at not only for the wind environment, but also for the thermal environment part. And for that ongoing project, Professor Jimmy Fong from Hong Kong UST, they will running the modeling. So I guess later he can answer your questions.
I'm looking forward to the
Yeah,
update.
thank you. Okay. Maybe let's move to the next presentation.